Hi everybody, Menachem, Brodie here with you once again from Vortex Training. Here today to talk a little bit about posture. When we get off the bike, we see a lot of cyclists who ride a lot. They have that Adam's apple sticking out. They have the hips rolled forward. Here, their chest is rolled down and in, and this is coming from riding on the bike. So we have two different ball and socket joints in the body. We have the shoulder, we also have the hip. Now the nice thing about the ball and socket joint is that it allows a lot of freedom and range of motion. The negative that we have from that is it means that there's a lot of different muscles that have to stabilize and work together to allow those muscles or that joint to stay balanced by those muscles. And taking us into a riding position is actually going to create imbalances. This is where strength and conditioning off the bike is very important. Now unfortunately for the last 20 to 30 years, a lot of strength and conditioning off the bike has been a little bit of stretching and avoiding the weight room. So maybe we'll do some push-ups, some planks, some lunges, things that are bicycle related. But really what we're looking for is to work the muscles that are not used during cycling in order to allow us to balance out the body. Now, when we start looking at poor posture, one of the first things that we impact is our ability to breathe. And that comes from being in a shortened position on the bike forward, and the pectoralis minor, which is a muscle that runs from the head of the upper arm bone into the second, third, and fourth rib, and the pectoralis major, which runs from the arm bone all the way to the inside of the rib cage. So we want to be very careful to make sure we're getting off the bike and stretching. We want to try and keep the chest nice and open. That allows the rib cage to contract and expand. And as anybody who's had a side stitch in through the ribs can tell you, it's very painful and it can really limit your breathing. So we really want to make sure you're able to use your belly to breathe as well as your rib cage. So when you're looking at the professionals, you see them as you saw in my sitting properly on your saddle video. We actually see the belly come in and out because they're using belly breath and the diaphragm, but we actually have to get you into a good posture off the bike to teach your body to best utilize that. So the next couple of videos we're going to release are going to show you a couple of those exercises you can do at home. And also very exciting, we have a product coming out which is going to give you a routine that you can do after or before you ride to help you start to open up the common tight areas in the body from biking. Now, two important things. At no point ever should you have numbness, tingling, or sharp pain in the body or in any of your extremities. If you do have that, you should talk to your primary care physician or seek out a physical therapist to figure out what's going on and to address those issues. This is not part of normal riding. I know people will talk about, oh, my toes go numb, that's normal. As a bike fitter, people come in having numbness on the toes, and working together we find a position where they no longer have that. So riding the bike should not be painful or cause pain except for burning in the legs in a good way, or the lungs, or feeling like you want to throw up when you finish a really good hard climb or a hard effort. So as we go forward the next couple of weeks, a couple of videos, we're going to talk about the common tight areas of the hip flexors. One is called the iliacus, which runs from the upper bone in the lower leg to the inside of your pelvis. The other is called the psoas, and that runs from the same or just below that point on the upper leg bone to your spine. So it creates a lot of tension and can create a lot of back pain and issues. The third thing we're going to talk about is use of the gluteals, or the butt, as an extensor. This is where about 35% of your power on the bike should come from in a proper pedaling position on a road bike. So we're going to talk about how to activate and open up those areas. So stay tuned, we have a lot of information for you guys coming, and I just wanted to give you this video to drop the seed into the ground so you can start thinking about your shoulders and your hips and your back. What feels tight, what feels good, and when do you feel best? So stay tuned for our next video, and remember, train smarter, not harder, and it is all about you.